we're going to go a little bit out of order of the agenda that you have that will help the students work with the technology that they've created for us today. And so at this time, I'm going to introduce Tom Thompson, who is with Federal Highways, Department of Transportation.
Good morning, ladies and gentlemen. It's a pleasure to be here and represent Secretary of Transportation Ray LaHood and Federal Transit Administrator Peter Rogoff. When we first found out about this endeavor, it was kind of giving us, it was going to be a small gathering of people that we would be able to interact with very closely, but it's apparent that the interest is much broader than that. And that, I think, also is true, as you'll find out through the day. They were talking about notices of funding availability. The Federal Transit Administration has already put out 2 of those, one for bus and bus infrastructure and one for urban circulator programs totaling $280 million. The applications for those were due on February the 10th, so if you missed that, I'm sorry to say it's kind of out of the picture for the rest of the year for those NOFAs. But the response was overwhelming. Just for the bus and bus infrastructure program, there were more than 260 applications received for well over $1 billion when we only had 80 million, of funds available. So it's going to be very competitive to select the applicants who have the best projects to fund in this year. But even though it's passed, don't give up hope. There's a future ahead, and there's a lot more money out there that's going to be available. In our FY11 budget, we've asked for $307 million, and there are other federal transit programs that total over $10 billion that can be used for this endeavor with a little bit of creativity. And we'll talk about those later. But if you know the 6 principles, the very first one on the list is to provide more transportation choices. And that's what Federal Transit is here to do, to provide more federal transportation choices to the people in the communities to be able to serve their needs and be sure that that community is a sustainable community. So once again, I'm glad to be here with you today in Louisville, and I look forward to answering your questions. Next, I'd like to introduce Sarah Heaton-Kennedy, who is a public health analyst with the Center for Disease Control and Prevention in Atlanta.
Hello. As Tom mentioned, my name is Sarah Kennedy, and I'm a public health analyst and a lead project manager for the Healthy Community Design Initiative at CDC. I want to just spend a couple minutes just telling you a little bit about what CDC is doing with regard to healthy community design and how we are attempting to position ourselves to be a supporting agency in this partnership. But first, I want to ask you a couple questions. Can you conveniently walk to your post office? Some of you might be able to, some of you might not. Do you feel relatively comfortable letting your children take their bikes to the nearest park while you're preparing dinner? As you age, do you feel confident that your quality of life is not going to be determined on by your ability to drive your own car? The answers to these questions we consider to impact public health in the United States. In fact, many aspects of community design impact public health. From physical activity to respiratory wellness to mental health, our scientific evidence shows that community design impacts directly and indirectly our health and well-being. And as a result, it also impacts our economy. Which is why we have a mission at the Healthy Community Design Initiative at CDC to support a better understanding of the relationship between the built environment and its impact on our health, and then to improve health through supporting improvements in the built environment. The goals we've set forth to accomplish this mission include increasing the evidence base to show what components of the built environment impact health and how, building the capacity at the federal, state, and local levels to turn that evidence into action to promote public health, and instilling a general ethic and practice among decision makers that includes a realistic consideration of the potential health impacts of proposed projects and policies affecting the built environment. To reach these goals, we target our efforts in the field of transportation, community and land use planning, and parks and recreation. Our key activity areas, you can see, are health impact assessment, research and evaluation, the development of a surveillance system, partnerships, and communication and education. I want to touch just briefly on a couple of our key activities. Health impact assessment is an evidence-based framework that is used to identify the health effects of proposed projects, policies, and plans on a population. So these are the potential health effects that a plan might have. HIA, as it's also known, is used to enhance the decision-making process so that it adequately considers how your project might impact the health of your community, and then to create recommendations on how to support the health promoting features or help to mitigate against the potentially negative health aspects of your project. HIA is used broadly internationally, and in the United States it's really just an emerging practice, but in the past 5 years it's been emerging quite rapidly. So in response to that, CDC is trying to build the capacity at the state level to respond to this desire from the grassroots for health impact assessment. So CDC is currently funding on a kind of a pilot basis state-level grants to 4 states. These grants are aimed at helping the states enhance their capacity for the state and local public health to work collaboratively with the state and local planning agencies to improve decision-making in such areas as transportation and land use planning. In our surveillance efforts, the Healthy Community Design Initiative at CDC is working with various partners to establish a more complete U.S. surveillance system tracking the health and human impacts of the components of the built environment. Our most recent example is the 2010 benchmarking report on bicycling and walking. The data in this report, such as biking and walking levels, safety, policies and provisions for biking and walking, and a survey of bike-ped infrastructure, as well as public health impacts, can assist government officials and advocates in measuring their progress toward increasing bicycling and walking, if that's what you're trying to do. It also can help in setting goals, planning strategies, and evaluating the results.